Welcome to Life Extension Live. I'm your host, Dr. Mike, and that is...
Dr. Crystal.
So, Dr. Crystal, I'm going to start off with a quiz question for you.
Okay.
What used to be the number one cause, or what we thought was the number one cause of ulcers in someone's gut?
Stress.
That
was right?
Yes, that's correct. Ding, 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 ding. Yeah. For years and years and years, we related stress factors to gastric acid. Cortisol even plays a role there.
Yeah.
And there is some connection. I'm not saying there's not. Okay. But it's not the number one cause now.
That's what we're going to talk about.
We're going to talk about the number one cause, H. pylori. It has a global prevalence of more than 40%, meaning 40% of the people throughout the world have this bacterium, H. pylori, and it is connected to ulcers.
And many other gastric issues.
Yeah, we're going to talk about all that, so hang in there. If you've had it, you're going to want to hear all this, because at the end, let's just talk about what we're going to discuss today on today's show. Let's just do it. On today's show, we will discuss what may be causing your stomach issues. Is it H. pylori? If so, how did you get it, and how do you get rid of it?
Yes. Now, first, H. pylori.
Yes.
Helicobacter pylori.
Yes. Did
I say it correctly?
Yes, you did.
Okay.
We just call it H. pylori for short. That's if you ever want to Google it yourself, whatever. Just type in H. pylori. That's how you can find it. So it is a bacterium. It's known for its causative role in gastrointestinal ulcers and stomach cancer. Even we'll get into that a little bit more. It lives. This bacterium lives literally in the lining of the stomach and into the small intestine. Right.
It has found a way to survive the really acidic environment, with a very low pH. And you would think that maybe the bacterium wouldn't be able to survive, but it does.
It does.
And so it lives there. It's also found in your stool, found in cavities.
Yep.
And so it's there with us in the U.S. About a third of the population has it.
Right.
So it's prevalent, not just worldwide.
It's the most common chronic bacterial infection. So how do you think it gets passed around, Dr. Crystal?
Well, feces to mouth, and what that means is, but many things in that way. Unfortunately,
we call fecal oral route.
Fecal oral route, yes,
right.
And that's. You're not washing your hands properly. The daycare.
Ooh, God. Yes.
You see, because most people acquire this bacteria or this infection when they're young.
Yeah. That's where it starts. Right.
That's where it starts.
Right. That's where it starts. And then for some, and we're going to get into why, because not, a lot of people can have H. pylori. You can have evidence of it, but it's not necessarily causing disease. In other populations and races, it does cause disease. So we'll talk about all that. But before we do, true or false, Dr. Crystal?
Okay.
Is kissing a way to get H. pylori?
Of course, because it's in your gastric secretions, it's in your mouth. So once you have it, you can pass it through that route.
Right, so kissing's up there. All right, let's give a little history about how we know there's a connection between H. pylori and ulcers and stuff, right? And it's a really interesting story. Right. It was it was two doctors, Doctors Barry J. Marshall and Robin J. Warren. They won the Nobel Prize in physiology and medicine for their 1982 discovery of the H. pylori bacterium and its role in peptic ulcer disease and gastritis. But do you know how they came up with it?
Yes.
What did they do?
They infected themselves. With at least particularly Dr. Marshall, he proved the theory by infecting himself from the bacteria he obtained from a patient. Yeah. And this patient had gastritis. He infected himself, and then he developed gastric symptoms.
Right, and that was kind of that was the beginning. It still wasn't widely accepted yet when he did this. It took some years, but eventually through more research, we recognized their work, and they won the Nobel Prize in 1982. 2. So here's the thing. Again, worldwide, lots of people have this, H. pylori. In the United States, people have it. Some people get gastritis and ulcers. Some people don't. There's variability in the way the bacterium or bacteria expresses itself, I think, in different people. And so we're going to talk a little bit about why that is. The first thing we want you to know is, bacteria, viruses, they come in slightly different versions of each other, just like we do as humans.
Yes.
Like humans, human, but we're slightly different. And so those are different strains and stuff. And we do believe that there are certain H. pylori strains that may be not as infectious as some other strains. So that's one possibility.
Absolutely. I think they're just like there are variations, genetic variations with the different strains and the different bacteria. The same with us.
Yeah. Let's talk about the genetic stuff.
Yes.
It's cool. Go ahead. You got some good information.
Well, you mean like which part?
Like the Japan part,
oh, yes.
other countries,
so
India.
I think what's very interesting is when you look at the world population in areas where you see most people in that area, they are infected with H. pylori. It's the places where they're very crowded, close living quarters. And so you find India, for example.
Yeah.
The majority of the population there, they do have H. pylori, but they have less incidence of H. pylori related disease.
Right.
Although, I mean, H. pylori, it is an infection, but the downstream effects of that infection with the gastric
the ulcers, the cancer
in particular is lower than other places that may also have higher rates of infection, like Japan. And so they call it's kind of like a little enigma, and that speaks to, is it a different strain of bacteria?
Is it the strain that's there?
Or is it the genetics of the individuals of that population?
Combination?
So you do see quite a lot of variation.
Other things that could determine whether or not somebody expresses the ulcers and ultimately the cancers from this could be just simply immune differences between people, gastric acid secretion differences, lifestyle.
The foods that they're eating, smoking, alcohol, all of that makes a difference as well. And these are, certain lifestyles that we know can be problematic, aren't the best for your health, right? And so you already have this kind of insult to either your GI system, that we know alcohol directly can damage the gut, and then you add the H. pylori, and now you have the perfect environment for gastric cancer.
The perfect storm.
Yeah, the perfect storm.
Something like that. I don't know. So we've kind of hinted on some of this, but let's go into more of the details of what's the real, scary stuff here with H. pylori. Obviously, we have some percents here. Usually, 10 to 15% of people. About 10 to 15%, of people infected with H. pylori are diagnosed with ulcers. 20% develop gastritis, which is now kind of the difference is ulcer is actually a wound into the stomach lining.
Sore, visible,
Whereas gastritis is more just, it's like generalized inflammation kind of all over the stomach, right? It's not like one particularly, it's all over.
Right.
And then here's the thing, with H. pylori, you're 8 times more likely to develop stomach cancer compared to other causes of ulcers, like NSAIDs and stuff like that. So ulcerations we've already known that there's a link to them with stomach cancer. Yeah,
correct.
But if you add H. pylori into the cause of that ulcer, it becomes 8 times more than, say, just like an aspirin that can cause ulcers.
Right, and then, many of you out there, you take your nutritional add-ins, and we do know that if you do have this H. pylori infection, you are not absorbing your nutrients properly. B12 could be a problem. Iron can be a problem.
Yep.
Vitamin C can be a nutrient of concern if you are dealing with this infection, if you have it.
Yeah, and then symptoms, stuff you might actually feel.
Oh, yeah, that's what they want to know.
Yeah, the dark stools, that's something to think about. That often can be indicative of a bleed that's higher up in your GI system, like in the stomach. So as that blood goes through your system, it gets tarry and yucky, dark looking. Pain in your stomach region. If there's this like dull and it kind of hurts a little bit, that's something you want to talk to your doctor about. Loss of appetite, unexplained weight loss, nausea, vomiting, especially if there's blood. Now in that case, if you're seeing blood this way, it usually is going to be more in the red, so it's going to look like blood. But if it goes through your system, it could be the dark stools.
Yep. And then we mentioned the iron, but unexplained iron deficiency anemia. That's an indication. If you're a doctor out there.
Yeah, well, why are they anemic?
Yes.
And if it's iron deficient, that often is related to blood loss somewhere. Where are you losing blood? And they will look for ulcers and gastritis and other things, like in your small bowel and large bowel as well. So Dr. Chris, if somebody hears all this and someone relate it to something we just said, and they're experiencing some of that, they go to their doctor, what might they experience when it comes to diagnosing H. pylori?
Yeah, so there are three kind of main ways to diagnose it for sure. There is a breath test, testing for urea, which is a metabolic, like a byproduct from that bacteria metabolism. So the breath test can be done at home or in the office. There is the stool antigen test, kind of like some of those proteins from the bacteria can be observed or detected in the stool. And then, of course, endoscopy, you could do the biopsy, and you can also detect it there. There are blood tests for H. pylori, but they can't distinguish between a current or a past infection. Yeah. So that's, I would say, if you've ever done a blood test or if you have one is positive, then you need to follow up with one of these tests, like a breath test to confirm the infection.
So when, if you do have H. pylori, you have some of these symptoms, maybe you've been diagnosed with it, there's some things you may want to avoid, like salt, right? We don't want to, too much salt can irritate.
Yes. Salt in general has been linked with gastric cancer. We looked at this a few months back, some research showing that. So yes, that from a dietary perspective, you want to limit salt, maybe add in some anti-inflammatory herbs and spices, cinnamon, turmeric. Turmeric. We do have some nutrients, some research showing that they can maybe suppress the colonization of the H. pylori.
So if you have it, your doctor is probably going to start you on a very common type treatment, and it involves 4 different medications, right?
Yes, yeah. I'm happy you brought that up because it's so important to take the medications.
Yeah, listen, you're going to be treated conventionally for H. pylori. We have add-ins, right? Is this where you were going? We have add-ins that can help.
Well, I think,
right, but
yes.
you're going to get these prescriptions.
Yes, Dr. Mike, and that was what I was going to say, and really more so emphasize what you stated, because often we go into the doctor and the doctor gives us 4 prescriptions. We're like, whoa.
Do I need all of these?
This is overkill. We always talk about like antibiotic resistance. A couple of those prescriptions will be an antibiotic. Yeah. You are going to get a prescription acid reducer. Yeah. But it's needed because if you don't kill it all, the first round,
it comes back, and now you have resistance.
Boom. Yeah. That's it.
So you're going to get, the first thing is you're going to notice there's what is called a PPI. It's a proton pump inhibitor that brings down, it controls acid and stuff like that. You're going to have 2 different antibiotics because you really need to hit them with these 2.
Have to hit it hard.
H. pylori loves to fight against antibiotics. So you got to hit them hard with the 2. And then there's usually like bismuth, which is like just like the stuff that coats and makes you feel better.
Yep.
That's going to be your quaternary therapy and that's well proven to work.
And it's important that, I mean, I hate to say it, we'll talk about nutritional add-ins. Very few will completely eradicate the infection.
Right. I think this is where this is integrative medicine. This is what I practice. I believe in it. I don't. My approach is, and I know we've talked about this. You agree. I don't look at it like, should I be Western? Should I be Eastern? Should I be whatever? I just want to do what's best. And sometimes it is a medication.
Right.
Sometimes maybe a nutrient add-in. Often it's a combo.
Right.
And that's where you get the best results. I'm not going to go on my soapbox here, but I'll go off on a tangent. But that's the truth. That's integrative medicine.
Yes. Now, one thing, though, because we talked about there are very few nutrients, but this zinc carnosine combination is a power bomb because that is available as a prescription. That combination, carnosine and zinc, is available as a prescription to treat stomach ulcers in Japan.
Yeah, it's been around for a long time as a prescription in Japan. So that's our first nutrient add-ins to consider. Talk to your doctor about is carnosine plus zinc. Then you go into probiotics.
There's so much we could say here.
I know there's a lot, but I think that the at the end of the day, that quadruple therapy, those antibiotics are powerful. You might have some issues with the healthy bacteria going away. Replacing them with probiotics, I think, is key.
Yes, and so you find probiotics combined with the conventional therapy can help to manage some of the diarrhea or some of the nausea, the upset from the antibiotics from that conventional therapy. So this is where, you integrate the conventional, and then what can we do to help to still keep the body strong, to help to support the good bacteria that's there, because we know antibiotics kill the good and the bad. And how can we minimize the side effects so that you can stay on your medication and do the full 14 days?
Which is how you're going to eradicate this thing. I like the way you said that. Nutrient add-ins, I always thought of it this way, right? Nutrient add-ins can sometimes help with efficacy, or sometimes they just help you deal with side effects so you can finish the treatment. And that's some way to look at it, and that's what probiotics do. And you can do the probiotics with the therapy. That's also, anytime people hear antibiotics, they feel like, well, I got to wait. You do not have to wait.
You do, and you can do it with the therapy. And the studies, we have 3 studies. We're not going to go over all of them unless there was one in particular you wanted to. But there's strains of bacteria and yeast probiotics.
Yeah, I mean, I think the big one for me was there was a meta-analysis of 10 clinical trials. Remember, that's where you're pooling a lot of the data together. You gain more confidence in the results. And they looked at lactobacillus probiotics, added to normal therapy. And what they found is by adding that, you double the odds of getting rid of the H. pylori.
So important.
Yeah, but here's the big thing. There were fewer side effects across the board. So even if it doesn't affect the getting rid of it so much, you're going to complete your 14 days.
Yep.
I think that's the key, and that was the study I liked.
Yes.
Okay. Licorice. Now, this is not the licorice you get at movies.
Someone asked that.
So it did. No, this is different. You want to explain that, like,
Well, yeah, this is a licorice extract.
Yeah.
We know that licorice is an herb, and it may be helpful. This study, when we first saw this research, Dr. Mike, there were questions. Was this with conventional medication? This was a standalone.
By itself.
Licorice, 150 milligrams of a standardized licorice. In this licorice, there were 3 or 4 active constituents from that licorice root. And 55 participants received it. 52 had the placebo, and at the end of the study, 56% of those who received licorice root had negative stool antigen tests for H. pylori.
Yeah, that's
compared
pretty amazing.
To 2% in the placebo group. So again, we're comparing 56% the individuals who had the licorice versus 2% in the placebo.
I mean, that's definitely powerful. Again, something to talk to your doctor about. But just keep in mind, your conventional doctors are really going to push for that quad therapy.
Yes.
And I agree with that. And I think this is something you could add to get even better efficacy.
I agree. And that, yes, and we have a study where it was added with the quad therapy. So we're seeing licorice, its application in both scenarios.
Yeah. Of course, vitamin D is also helpful. When is vitamin D not helpful?
Yes.
But I don't want to focus on vitamin D because we talk about it so much. I'm more interested in the vitamin C numbers we have here.
Yeah.
Vitamin C.
Vitamin C seems to be more preventative than curative. We do see that. And the research is indicating you do your full quad therapy, then you add in your vitamin C.
After. Yeah.
And that vitamin C, it can be kind of the cleanup vitamin C, any remnants of H. pylori that may be there, and as well as preventing a reoccurrence.
And I think in those cases, am I wrong that it was IV vitamin C or what?
It was high dose vitamin C.
It was high dose vitamin C.
And sometimes you need to do the IV to get those higher doses.
But remember, even with the normal conventional therapy, which has a high efficacy, the H. pylori is a fighter. It doesn't. If you just a few of them are surviving, you're going to have right. They do. They come back.
They do.
And so something like vitamin C to just finish the job at the end, I kind of like.
That's nice.
Yeah. Aloe vera. What do you think?
Well, according to the research, studies have found that aloe vera does have an antimicrobial effect, also can help to break up those biofilms, those little bacterial colonies that are so hard to
penetrate.
Yeah. I guess it's a tool.
Aloe vera, remember it was huge years and years ago?
My dad, if you're watching, I know you're all over this. He
you told me
loves his aloe vera. So this is something that you can add in, and it's good for not just H. pylori.
And then there's one you may not have heard of. It's called picoriza. Right? I already forgot what it is. What is picoriza?
It's an herb, right?
It's an herb.
I believe so.
It's an herb, and it's known to disrupt the ability of H. pylori to actually bind to the gastric cells, and that right there. If a bacterium can't bind, it can't infect. It's just going to be washed on out.
So adhesion.
Yeah, adhesion.
Is
disrupted. Right. So there you go. There are some nutrient add-ins that you may want to talk to your doctor about if you're starting that 4-drug therapy. Listen, H. pylori, it's prevalent. It's out there.
Yeah.
If you have any of those symptoms, we really encourage you to talk to your doctor, get a proper diagnosis, and start treatment.
Yes, so important.
Dr. Krista has great information.
Yes, I think it's fascinating.
We have a protocol, right?
Well, it's a peptic ulcer protocol, since we know that H. pylori is kind of the number one cause of the peptic ulcer.
Right.
And that's at lifeextension.com/stomach health.
And when you're there, you can use the discount code LELIVE for 10% off $50 or more plus free shipping and handling. That's all over at lifeextension.com. Don't forget, we go live every Wednesday, 12 noon Eastern time, whatever channel you watch us on. Like it, share it, comment, review it, ding it, thumbs it.
And ask us questions. Yeah. We are begging for questions.
Yeah, ask us questions. We really love it.
Because we will answer your questions on our show. That is a promise from us to you.
There you go. That's live Wednesday every 12 noon Eastern time. I'm Dr. Mike.
I'm Dr. Crystal.
We'll see you next time.